DuPéré, board-certified plastic surgeon. Body implant is of particular interest to me. I learned calf augmentation back in 2004 with one of the pioneers in calf augmentation surgery. A calf implant is made of a silicone elastomer, which is solid, so not a gel, but it is very, very soft, like a cushion. The implants come in various sizes and shape and are inserted in the back of your calf through an incision in the crease behind your knee. A calf implant is inserted under the fascia. The fascia is a thick layer over each muscle, which will keep the implant in place and prevent the implant from moving. Now, there are various reasons why somebody would seek a calf augmentation with the implant. Our most common patient requesting calf augmentation is a patient who regularly goes to the gym but cannot grow that calf muscle. Now, we have both guys and girls looking for calf augmentations. In the case of ladies, most of our ladies are concerned about their lower legs looking skinny in relationship to their thighs. So in those ladies, we're looking for longer, thinner implants that will restore the harmony and the balance between the lower leg and the upper leg. There are a few exceptions to this rule where we have the fitness and the bodybuilder ladies where we will treat their calf as we do with males. So with males, most of the time we're looking for bulk. The calf muscle is made of two heads. We call the muscle the gastrocnemius muscle. In most people, the inner muscle is the most important one for a harmonious leg. So it is very commonly done where we do a calf augmentation on the inner side only, on both sides. Now, for these serious bodybuilders where size matters, we will look at 2 implants per lower leg, where both the inner and the outer gastrocnemius muscle will be increased. All those techniques are performed again via a small incision in the crease behind the knee. I do also see in my practice a subgroup of patients who have asymmetry of the lower leg. That asymmetry can be secondary to polio infection, from also a club feet surgery as a child, or just from any trauma. Those patients come with a skinny, thin lower leg on one side and a thicker, compensated larger leg on the other side. I commonly recommend in those asymmetry conditions an augmentation of that smaller calf muscle with an implant and liposuction on the larger calf. I typically recommend to my patient the use of crutches for several days after surgery to help with the pain management. For my patients who have a desk type of work, they normally can plan on resuming work activities within 2 to 3 weeks. For patients who have more physical type of work, I recommend 4 to 6 weeks of rest. Finally, for anyone considering returning to the gym, I recommend 2 to 3 months sabbatical. Because my interest in body implants and calf augmentation has been growing over the years, I now do see people from all corners of Canada coming to Toronto for their procedure. Calf augmentation surgery is not the most common procedure, and it's not something that plastic surgeons learn during specialty training. So it is very important for you to do your research and to find a plastic surgeon who has a strong interest and experience in calf augmentation.